my name is Wayne Smith. I'm doing practical assessment 4 in health and fitness with AIPT. Today's session has been planned and organised with my client. I've given him a time and location in which to come. I've arranged with other working out and have the session planned. Other personal trainers know as well, and it's all good. I've done an assessment of the place. I've cleared any hazards that may have been around. All the equipment is ready to go and in good working order. So I just go get my client now. So pause that.
How you going?
Good, yourself? Good. You're ready for today's session?
Yeah, let's get it done.
Alright. First question I'd like to ask you is, have you got any health problems at the moment which might stop you from doing today's session?
No, nothing.
Okay, I'll run through what we're going to do in a minute.
Yep.
But first of all, we've got a few just pre-health questions which I'd like you to answer.
Yeah, sure.
As we've done part 2 before and we know what you'll actually want and everything, I just want to get these questions out of the way. So,
Yeah, no problems.
Take a seat, mate. Have you ever had a heart attack or surgery or a stroke?
No.
Excellent. Has your doctor ever told you that you've had heart trouble or vascular disease?
No.
Has your doctor ever told you that you have a heartburn?
No.
Excellent. Do you suffer from pains in your chest, especially during exercise? Good. Do you ever get pains in your calves, boats, or your legs during exercise? Those not due to soreness?
No.
No. Good. Do you ever feel faint or have spells of severe dizziness, especially during exercise?
No.
Do you ever experience swelling or accumulation of fluid around the ankles? No. Do you ever feel your heart suddenly beating faster, skipping beats, either at rest or during exercise?
No.
No. Excellent. That's all good. Have you ever had chronic obstructive pulmonary disease, intestinal lung disease, or cystic fibrosis?
Nope.
No. Have you had an attack of shortness of breath that developed when you're doing anything strenuous at any time in the last 12 months?
No.
Have you had a shortness of breath that developed after you stopped exercising at any time in the last 12 months? No. Good. Have you ever been woken at night by an attack of shortness of breath at any time in the last 12 months?
No.
Do you have diabetes?
No.
Do you have isolated wounds or cuts on your feet that don't seem to heal?
No.
Good. Do you have any liver, kidney or thyroid disorders? No. Excellent. Do you experience unusual fatigue or shortness of breath when doing everyday activities?
No.
Is there any other physical reason or medical condition that you may think of or taking any medication which could prevent you from undertaking an exercise program?
No.
Alright. So today's session is going to be, firstly we'll be doing a fitness test, an endurance test, so it'll be a push-up test.
Yep.
Then followed by 3 different strength exercises.
Yep.
One for your chest, which is a dumbbell chest press.
Yep.
And then we'll be doing a single arm row. Yep. Followed by a weighted lunge.
Yep.
And then we'll do 2 different cardio exercises.
Yep.
One on the rowing machine.
Yep.
And one on the bike.
Yep.
And then we'll do an innovative cardio training on the boxing bag.
Awesome.
And focus mitts and that type of thing.
Awesome.
And we'll finish off with a couple of different stretches. How does that sound?
Sounds good.
Okay, let's do it. Yep. Okay, Banker, today we'll start off with the test with our muscular endurance test, so it's a push-up test. Yep. So what I'm going to get you to do is just do as many push-ups as you can, and we'll assess after that how you go and see how you go with it. Yep. Have you done a push-up before? Any
I
push-ups
have.
Before?
Yep.
You have? Yep. So you know all about it?
Yep.
So I'll just run through it anyway.
Yeah, sure. Yep.
The main thing is to keep your back nice and straight.
Yep.
And your head in a neutral position. Yep. And your breathing is important as well. So on the way down, you're breathing in, and on the way out, pushing out. Yep. So push up, you breathe out. Also keep your core engaged. Yep. So everything's nice and straight and level on your way down. So it comes just above the pad. Yep. And then up. As many as you can.
No worries.
Just give you a demonstration. So first we hop down. So hands shoulder width apart. Yep. Up onto your toes, back. So all you do is come down, just touch, and then up. Yep. Try not to look up or down or anything like that. Just keep your head in a neutral position. Yep. Down and up. Great. Okay. See how you go.
Get it done.
Yep. Excellent. 1, 2, 3, 4, 5, 6. Remember your breathing. 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Excellent. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 40. You're doing great. 2, 3, 4, 5, 6, 7. Make sure you push up all the way. 8, 9, 50. Awesome. Well done. How does that feel?
Good.
Good? Feel it across your chest?
Yeah.
Yep. Alright. Yep. Okay, so 50 is an excellent result for your test. Okay,
Excellent.
so what we'll do there is we'll record that as being 50, and later on, 4 weeks down the track or whatever, when we reassess,
Yep.
we'll do it again and we'll see how much you improve with that test and that type of thing, and see how your training's going with that.
Yep.
But that's a really good start. Good
Awesome.
job. Excellent. Alright. Okay, Maka, so the next test that we're going to do is a dumbbell chest press. You've done chest presses before? Yep. Okay, so this is to develop the inner and outer pectoral muscles. Using the dumbbells as well instead of the bar, it also helps other muscles stabilise. So using other muscles to stabilise yourself, which also works it out. So the main muscles that we're using today with this are the pectoral major, the tricep brachii, anterior deltoid, or the shoulders and the triceps, and the chest. They're the main ones, and also your core, your abdominals and that type of thing to stabilise you when you're doing it. So once again, I'll get you to focus on your breathing and more so the technique. So on your way down, breathe in. On your way out, push up.
Yep.
So breathe in, breathe out on your way up. Keep your core nice and stable, feet flat on the ground. So try not to arch back and that type of thing if it gets heavy. We've got a decent sort of weight there, so it's not too bad.
Yep.
And I'll get you to do a set of 10 for me.
Yep.
But I'll demonstrate how I want it done first.
No worries.
And we'll go from there.
Right.
So it's best to have the weight sort of near you to start with, especially if they're a little bit heavier. You're in a line that it's easy just to bend down, bring them straight up onto your knees.
Yep.
And from there, you just lean back, bring them up above your chest, feet flat on the ground, engage your core so it's nice and strengthy.
Yep.
Head just laying on the bench, and then you bring it down, and then back up. You can squeeze at the top if you like.
Yep.
And down, and up. And when you're finished, stand your weights, sit up, and just place them on the ground. Okay, so I'll get you to do 10 for me. Remember to breathe in on the way down and breathe out on the way up. So that's 1, 2, that's excellent control. 3, 4, 5, 6, 7, 8, excellent. 9 and 10. That was brilliant. How does that feel?
Yeah, good.
Yeah? Whereabouts did you feel? Across your chest?
Yeah.
As you're going down?
Shoulders.
Yep.
Shoulders.
Excellent. Alright. Yeah, we'll move on to the next one.
Excellent.
Okay, Macca, the next exercise we're going to do today is single arm row.
Yep.
You've done this before, obviously? Yep. Okay, so this exercise works your latissimus dorsi, or your lats.
Yep.
And in the back, your rhomboids and your trapezius, which is your traps as well, and your bicep brachii.
Yep.
And also different stabiliser muscles when you're holding down, that type of thing.
Yep.
Okay, so I'll give you a demonstration of what to do.
Yeah, great.
And again, your breathing has to come into it.
Yep.
So you breathe in on the way down,
Yep.
out on the way up.
Yep.
Keep your back nice and straight through the whole motion.
Yep.
And get the stretch right at the end. Like, make sure that you stretch that lat right out, and then pull it right up to your chest. Squeeze your shoulder blades together.
Yep.
So you get that extra squeeze, and that's what you're going to be working. You want to be working more your back than your bicep. You don't actually want to be doing a bicep curl because it won't help your back. You actually want to do the whole movement to get into that back muscle.
Yep.
Okay. So We're going to use one way. Again, just have it close to where it is. So one knee on the bench like that.
Yep.
The other one out in front, holding on to the edge. Leg close by. I usually just like to have it about there.
Yep.
Bend over, grab the weight. Okay, so you stretch that lat right out, you keep your back nice and straight, you bring it up to your chest, and then down, and down.
Yep.
So you breathe. Good, and we're done.
Cool.
Okay, so you can do a set of 10 for me, that'd be good. Excellent, nice straight back. It's 1, 2, 3, 4, 5, 6, don't forget to breathe, 7, 8, 9, and 10. Excellent, how'd that feel?
Yeah, good.
Yeah?
Very good.
Is the weight alright for you?
Probably got a bit heavier, but
A little bit heavier?
Yeah.
Not bad?
yeah, it's good.
Yep. Okay. We'll move on to the next exercise.
Excellent.
Yep, that's excellent, Macca. I'll get you to do the other side now and we'll, yep. 1, 2, 3, 4, 5, 6, excellent breathing. 9, and 10. Okay, Macca, come to this third exercise that we're going to do, weighted lunges.
Yep.
You've done them before?
Yeah.
Yep. Okay, so lunges actually work quadriceps.
Yep.
And your glutes maximus, your buttocks, thighs, and your hamstrings.
Yep.
So with the technique, instead of stepping forward and doing it,
Yep.
putting a lot of extra pressure on the knee and that type of thing,
Yep.
what we're going to do is we're actually going to step back.
Yep.
Okay, so you're actually going to lunge down there,
Yep.
holding onto the weights by your side.
Yep.
Keep your chest and back nice and straight. And all it is I'll demonstrate. Again, focusing on the breathing.
Yep.
So breathe in as you come back, and then out as you come up. Come up. So nice and back, nice straight back. So step back, down, and up, down. Okay, so do a set of 10. So alternate each one. Also, if you're ever picking up weights from the ground, make sure that you keep your back nice and straight.
Yep.
Bending out like this, you can always go backwards. Okay. So you put your back out. So it's easy just to keep your back straight. Come back up.
Right.
Just keep them up there for you. One, 2, step back this way, 3, next, 4, 5, and you're breathing, 6, 7, 8, 9, and 10. Excellent. Put the legs down. How'd that feel?
Yeah, good.
Yeah? Feel it in your legs?
Yeah.
Quads? Yep. Excellent. Alright, we'll get on to the next exercise, which is the rowing machine.
Yep. Right.
Show you what to do there.
Excellent.
Okay, Marcus, now we're coming to the rowing machine.
Yep.
This is a constant resistance rowing machine, so it's basically just filled with water. So all the time you get resistance.
Yep.
You've worked the rower before.
I have, yes.
Give your demonstration.
Yep.
So you obviously have your feet correct.
Yep.
With this as well, keep your back nice and straight.
Yep.
Posture's paramount in this one. You don't want to be bending forward, coming forward, and then straightening right back.
Yep.
On your dials, you've got different settings there.
Yep.
So you've got time, you've got calories burned. It's all pretty self-explanatory.
Yep.
So start off, have your, yep, elbows over. So where you can start, drive through the knees.
Yep.
So push back, and as you come out, give it a pump right at the end. That's it. Excellent. Okay, you go for 5 minutes. In about a minute, I'll get you to go a bit quicker. Keep that posture up to weight. And when you're doing this, your heart rate's going to increase, which means that your breathing's going to increase, which means you're going to get more oxygen into your lungs to get it around your body and into your muscles that are working. Alright, that's excellent, Macca. We've been going for 4.5 minutes. Now I want you to pick up the pace, go as hard as you can for the last 30 seconds and see how you go. Make sure you keep the technique correct. That's excellent. Push through it, make sure you keep your breathing right. That's excellent, that's good form. Drive through your legs. Yep, keep going. 10 seconds. Push it. Alright, slow it down. Excellent, how did that feel?
Pretty good.
Yep. Got your breathing good?
Yeah.
Yep. No, that's good. Excellent. Okay, we'll move over to the bike now.
Awesome.
Okay, Macca, we're here at the bike. First thing you need to know about the bike is you've got to get it set up right. If you don't get it set up right and your legs don't extend to the right distance, then you're going to have more problems than anything. Okay,
yep.
So with a bike, it should be hip level.
Yep.
The seat should be hip level. So when you extend, your leg goes right down and then up instead of halfway or all the way down and you're overextending and that type of thing. So is that about right?
Yep, that's
so
it.
Just get you to jump on. Alright, so on the screen here we've got a whole heap of different things that you can do, possibly do if you want to do weight loss. It's all computerised, which we all know about.
Yep.
Or you can go into a quick start. What we'll do today is just a quick start and we'll go for, say, a 5-minute ride again.
Yep.
In the last 30 seconds I'll get you to go hard, and with this as well you get your workload level. So one's light, okay, so all you need to do is press it up, it'll increase the resistance, okay. And again, up here it says calories burned. It also has the time that you do it. It also has calories an hour. Time up here, how long you've been going for. Also all this up the top, which keep it on. Yeah.
Yep.
If you ever need to stop in a hurry, or just stop it, there's a big stop button right there.
Yep.
Yep. Okay. Okay, Mackie, you've been going for 4.5 minutes. I want you to ride, to press hard, push through it, get your breathing. And once again, your heart level is rising, blood pressure's up. You're getting the oxygen into your body, into your muscles that are working the hardest. You probably feel a bit of lactic acid build up by now, and your legs will be feeling a bit sore. So keep pushing through that. Another 15 seconds, push through it. That's excellent. Doing really well. Nice straight back. Not hunched over, that's excellent. Okay, we've got 5 seconds. 4, 3, 2, 1. Okay, slow it down. Okay. How does that feel? How do your legs feel?
Cooked.
Good? Yeah, cooked. Excellent. Okay, we'll go on to the next exercise.
Awesome.
Okay, Michael, this is innovative cardio. We're going to get you to start off with doing head punches. Yep. For 20 seconds as fast as you can. Yep. Down to body punches for another 20 seconds, and then rip it out. Yep. For the last 20 seconds. So we'll just go for a minute, and get your breathing, like get into a good rhythm of breathing now. Yep. And I'll tell you when to change each time. Okay, so 3, 2, 1, go. Excellent. That's good pace. Nice form. Good technique. Okay, that's 10 seconds. Another 10 seconds. Push it over. Be quick with the hands. Excellent. That's what I like to see. 5 seconds. Okay, down to the middle. Excellent. Don't forget your breathing. That's good technique. 10 seconds. Go a bit quicker if you can. Now it's getting harder. Your breathing, your oxygen's getting in there. Your arms should be feeling it by now. Another 5 seconds. 4, 3, 2, 1. Okay, body reps. That's it. Excellent. That's good. That's power. 10 seconds, 10 to go. 5, 4, 3, 2, 1. Yep. Alright, have a rest. We'll have a rest for 30 seconds. I'll put on some mitts and we'll do some jab, cross, hook combinations for another minute. Okay, Mako, you mentioned before with pre-screening that you had quite an interest in boxing and different combinations and that type of thing with the boxing. So with these mitts and that type of thing, we're going to do a jab cross combination. Yep. So jab cross hook for the first one for 20 seconds. Then we're going to do jab cross uppercut for the next 20 seconds. Then we're going to do jab cross hook hook for the last 20 seconds. You right? Yep. Okay. So in 5, 4, 3, 2, 1, go. Excellent. That's good form. Move around. Excellent. It's nice and powerful. Breathing's good. That's good. Okay, 10 seconds. Yep, and again. That's good. Good. Yep, 5 seconds. 3, 2, 1. Okay, jab cross uppercut. So jab cross and come down. So uppercut. Which side? Backhand? Yeah, front hand. Try front hand. Jab cross uppercut. Yep. Okay, change legs. Try this. Excellent. And again. Ten seconds. Good. That's powerful. Good. 5 seconds. Push through it. 2, 1. Okay. Okay, so jab, cross, hook, hook. So it's just jab, cross, lead with front hand. Make sure the technique's right. So jab is the front, cross, hook, hook. So when you hook with the front leg, make sure that that back foot pivots as well. So that comes in, and then you get the back hip into the second one. Yep. So you get the power out of it. Okay, jab, hook, excellent. Okay, 20 seconds. 2, 1, go. Excellent. Good. Okay. Okay, you're feeling breathing by now. Suck them in. Let's keep going. Excellent. Good. 10 seconds. Keep going. Push through it. Your arms will be burning. Good. And again. 5 seconds. And 5, 2. Excellent. Okay, have a rest. Okay, Mako, that's excellent. Your training session today has been top notch. I'm really impressed with your technique and your form with everything. So now to cool down a bit, we're going to do a few stretches. Yep. So working your legs from the bike and the rower and that type of thing. Yep. Will stretch your quadriceps. Yep. Okay, so on one foot, bring the other foot up behind. Yep. Okay, squeeze your bum, kick your hips out, and you should be able to feel the stretch all the way down the front of your leg there. If you find it hard to stabilise, you put your hand on the wall if you're near a wall, or you just focus on the spot on the ground and hold the stretch for 30 seconds. Alright, change legs. So how was today's session?
Yeah, good.
Yeah.
Loved it.
Can you feel it in your chest, in your legs?
Everywhere.
Feel it everywhere?
Yeah.
That's good. You notice your breathing pick up when you get into the cardio sort of work, compared to the weights and everything like that? Alright, so give your legs a bit of a shake out. Okay, next step. Oh yeah, stop that. Okay, so for the last stretch today, Mako, because you've done a lot of like upper body work with your boxing and that type of thing and the weights and that, we'll do sort of like an innovative stretch. So this one, we'll start with the shoulder roll. So that will get your whole shoulder going. Okay, for 10 seconds. You should give that a nice good stretch as you're coming around. You should feel it in the blades of your shoulders as well. Okay, now coming round into a chest stretch. You should feel that stretch all the way through your chest. For another 10 seconds. Excellent. Yeah, at that height. Okay, now bring it out in front and across your body. Another shoulder stretch. Another 10 seconds. Your breathing is going back to normal, which is good. Alright, the other arm. Nice and slow. Feel the stretch as you're coming around. Yep. Hands to the chest. Across the body. You got any questions about today at all?
No,
No?
it's been pretty good.
Excellent. Alright, shake hands, Jones. How's that feel?
Yeah, good.
Good?
Yeah.
Excellent. Alright.
Excellent.
Thanks
Thank
for
you.
that.
Thank
Yep.
you.
Okay, this is my special populations video on high blood pressure first of all, also known as hypertension. It's serious, it can be serious, and the health problems can be anything from a heart attack to a stroke to kidney failure to heart failure. Hypertension usually produces no symptoms. Hereditary factors, obesity, smoking, a diet high in salt, and lack of physical exercise can all lead to hypertension. If a client was to come to me and it was discovered they had hypertension, I would refer them with a referral letter to a doctor or allied health professional and get a clearance before setting out an exercise program for them. Once the clearance was given, depending on the referral, a modified exercise program could be done. The modified program would be done specifically not to put any extra pressure on the heart. For instance, no exercises done above the heart level. For instance, lat pull downs, shoulder presses, push-ups, that type of thing, leg raises, laying on the ground. Anything that raises the limbs above the heart level could cause problems. So we'll try and eliminate all that. Also try and avoid spikes in the workout, so you don't really want the client to have their heart racing really fast. You want to sort of minimise that and go to a medium to moderate sort of workout. You don't want to make the client feel uncomfortable either. I'd always ask them how they are feeling during the exercise program, if there was any pains or if they felt like their heart was racing, etc., and then I would adjust it accordingly or stop it altogether. So some of the modifications that you could do would be, instead of a normal push-up, do a wall press. Instead of a bench press, do a seated chest press. So there's no pressure placed on the heart while they're doing these exercises. Another good thing is, when warming up the client, say for 10 minutes, just gradually warm up on a treadmill, and same as warming down, cooling down, another 10 minutes on the treadmill, as to not get their heart racing real quick, real fast. It's a gradual process, and that would help them out. Next is lower back pain. A client with lower back pain could have anything from spinal injury, pinched nerve, or it could be muscular. Could have been caused by something as serious as a car accident, all the way to the way a person even sits at work. Once it was established with the client how they got the back pain, say if it was caused by an accident or the client had spinal problems Then I would refer them to, again, a doctor or allied health professional to get a clearance first. If it was accident related, the doctor might even prescribe some rehabilitation exercises for that client as well. Strengthening the core muscles like the recto abdominals, the transverse abdominals, and the external and internal obliques would help support the back as well. Some of the modifications for exercises, instead of doing it, say, a floor crunch, you could do it on a fit ball and give the lower lumbar back more support as you're doing the crunches and that type of thing. A fit ball could also be used for a squat up against the wall and down. Instead of putting pressure on the lower back, it takes the pressure off a little bit. Different stretches and exercises like hip bridges or side planks can also strengthen that area, which would help it. And shoulder injury, I would first establish what sort of shoulder injury the person has or has had in the past. We would then work out the type of exercises would best suit that injury and not to cause pain and be uncomfortable for the client, and also be beneficial for the recovery process. There'd be nothing worse than starting a client on an exercise program but have the weights, for instance, too heavy and do more damage than good. I'd always ask the client how they feel while doing the exercises, if there was any pain anywhere, and if so, adjust accordingly. Again, if it was accident related or surgery related, then I'd get the client to obtain a doctor's clearance before doing any exercise program. So with pre-existing injury, it'd be best not to aggravate it more. Try not to use heavier weights and that type of thing, or raising heavy weights above the head in the shoulder press. Type of modified exercises you could do would be shoulder rolls, those types of exercises, nice and slow. Up against a wall, even just slow shoulder presses. Anything with a lower sort of weight, and just to let that area recover more than anything. Work the muscles around it. Work the muscles to strengthen that muscle as well, or that shoulder injury, and just keep an eye on it, and keep an eye on the client as well to make sure that they're comfortable and they're not hurting. Yep. Thank you.